Welcome to today's video, where we'll be exploring a rare and fascinating condition, bladder paraganglioma. We'll delve into its origins, how it affects the body, its symptoms, treatment options, and more. Join us as we unravel the complexities of this unusual tumor. The exact cause of bladder paragangliomas is not fully understood, but they arise from specialized neuroendocrine cells called chromaffin cells. These cells are normally found in the adrenal glands, but sometimes they can occur outside the adrenal glands, in locations like the bladder. The development of these tumors may be sporadic or linked to genetic mutations in genes like DHB, SDH, DHC, SDH, DHD, SDL, RI, NF1, and MAX. These genetic predispositions contribute to a higher risk of developing paragangliomas, including those in the bladder. Bladder paragangliomas, like other paragangliomas, secrete catecholamines hormones such as adrenaline, noradrenaline, and dopamine. These hormones flood the bloodstream, leading to a cascade of physiological effects. The excess catecholamines cause vasoconstriction, increasing blood pressure. They also stimulate the heart, leading to increased heart rate and palpitations. This hormonal imbalance is responsible for the characteristic symptoms experienced by patients with bladder paraganglioma. The tumor's location within the bladder can also cause localized effects, such as irritation and bleeding. Bladder paragangliomas are rare tumors, accounting for less than 0.5% of all bladder tumors. They are more commonly found in adults, typically between the ages of 40 and 60. While they can occur in both men and women, some studies suggest a slightly higher prevalence in females. Due to their rarity, accurate epidemiological data can be challenging to obtain. The signs and symptoms of bladder paraganglioma can vary depending on the size and activity of the tumor, as well as the amount of catecholamines it secretes. The most common symptoms include paroxysmal hypertension, or sudden spikes in blood pressure, often accompanied by headaches, palpitations, and excessive sweating. Patients may also experience anxiety, tremor, and flushing. Because the tumor is located in the bladder, hematuria, or blood in the urine, and voiding difficulties are also frequently observed. Diagnosing bladder paraganglioma typically involves a combination of imaging studies and biochemical tests. A 24-hour urine collection to measure catecholamine levels, specifically metanephrines and norepinephrines, is crucial for confirming the diagnosis. Elevated levels strongly suggest the presence of a catecholamine-secreting tumor. Imaging modalities, such as CT scans, MRI, and MIBG scans, help to visualize the tumor within the bladder and assess for any spread to other areas. Cystoscopy with biopsy confirms the diagnosis histologically, allowing for microscopic examination of the tumor cells. Bladder paragangliomas are generally classified as benign or malignant based on their histologic features and clinical behavior. However, differentiating between benign and malignant tumors can be challenging. Some features that suggest malignancy include local invasion, distant metastasis, and specific histologic markers. Due to the difficulty in predicting behavior, all paragangliomas are considered to have malignant potential. The primary treatment for bladder paraganglioma is surgical resection, either partial or radical cystectomy, depending on the size and location of the tumor. Minimally invasive approaches, such as laparoscopic or robotic surgery, may be considered in select cases. Prior to surgery, patients often receive alpha-adrenergic blockers, such as phenoxybenzamine, to control blood pressure and prevent hypertensive crises during the procedure. In cases where surgery is not feasible or the tumor has metastasized, radiation therapy or chemotherapy may be used to manage the disease. MIB therapy using radioactive iodine Hun-31-metidobenzylguanidine can also be effective in targeting the tumor cells. Currently, there are no specific prevention strategies for bladder paraganglioma, particularly for sporadic cases. However, individuals with known genetic predispositions, such as mutations in SDHB or VHL genes, may benefit from genetic counseling and regular screening to detect tumors early. Avoiding risk factors associated with other bladder cancers, such as smoking, may also be advisable. The prognosis for bladder paraganglioma depends on several factors, including the stage of the tumor, whether it is benign or malignant, and the completeness of surgical resection. Benign tumors that are completely removed have an excellent prognosis with a low risk of recurrence. Malignant tumors, or those that have metastasized, have a less favorable prognosis. Recent research is focused on identifying new genetic markers that can predict tumor behavior and response to therapy. Immunotherapy and targeted therapies are also being investigated as potential treatment options for advanced or metastatic bladder paraganglioma. Ongoing research efforts are aimed at improving outcomes and quality of life for patients with this rare disease.